Have you ever wondered why you keep waking up at night to urinate? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to explain the common reasons people wake up at night to use the bathroom. If you enjoy this video, be sure to subscribe and hit the notification bell so you don't miss any upcoming content. Waking up during the night to urinate is called nocturia. We typically define nocturia as getting up 2 or more times during the night to urinate. This does not include the trip to the bathroom right before going to bed, or the one you take first thing in the morning after waking up. Even though that is the medical definition, many people still find it very frustrating, even if it happens just once a night. Before we get into the reasons this happens, an important thing to consider is what exactly wakes you up. Are you waking up with a strong urge to go to the bathroom, like your bladder is telling you right away that you need to go? Or are you waking up for another reason, and then deciding to use the bathroom because you're already awake? Those are actually two very different situations. If something else is waking you up and you only go to the bathroom because you're already awake, then the real issue may be your sleep quality. In that case, it's important to focus on sleep hygiene and figure out why your sleep is being disrupted. At some point, I'll make a full video on how to improve your sleep at night, because good sleep is incredibly important, not just for your urologic health, but for your overall well-being and many other aspects of your health. Now, if you are waking up specifically because you need to urinate and it's happening often, there are several possible reasons. One major reason is that your bladder capacity may have changed, meaning your bladder is holding less urine overnight. This can happen for a variety of reasons. For example, it may be related to bladder overactivity. In this situation, the bladder muscle begins to contract or spasm before the bladder is actually full, creating that sudden urge to urinate. There are several causes for this. It may be due to an overactive bladder condition, which itself can develop for many different reasons. Another possibility is a blockage in the urinary system. In men, an enlarged prostate can partially block the flow of urine and make the bladder work harder, which can lead to more frequent urges. In women, certain surgeries, such as a sling procedure or other treatments involving the urethra, can sometimes create some narrowing that affects urine flow and causes the bladder to behave as if there is a blockage. Overactive bladder can also be connected to neurologic conditions, aging, or other factors that may cause the bladder to become more sensitive or overactive. If there is an underlying reason causing that bladder overactivity, the first step is to identify and treat that problem. Another possible cause is a change in the bladder's compliance. Normally, your bladder is very flexible, much like a balloon. It stretches and expands while holding urine without creating much pressure. However, certain conditions, such as a neurologic injury or past radiation treatments, can affect this flexibility. When that happens, the bladder becomes stiffer and is no longer able to hold as much urine as it normally would. Another major reason you might be waking up more often at night is that your body is simply producing a larger volume of urine during the night. Why does this happen? Interestingly, as people age, especially after around 65 years old, the body naturally shifts how it produces urine. About 1/3 of your daily urine production may occur during the nighttime. Because of this, it's actually quite normal for many adults over 65 to wake up once during the night to urinate. However, if your body is producing a large amount of urine at night, there could be several explanations. Sometimes it's simply due to age-related changes. In other cases, it could be related to a medical condition. For example, conditions such as diabetes mellitus, diabetes insipidus, or something called primary polydipsia can lead to increased urine production. Primary polydipsia happens when a person feels an unusual urge to drink large amounts of fluid throughout the day because of a hormone imbalance affecting the body's thirst centers. These issues can often be evaluated and treated with the help of your primary care doctor. Another factor to consider is swelling in the lower legs or feet, known as edema. This swelling can occur due to conditions such as congestive heart failure or problems with the veins in the legs. During the day, fluid can build up in the lower parts of the body, but when you lie down at night, that fluid is reabsorbed into the bloodstream and eventually processed by the kidneys, which can increase urine production while you're sleeping. Finally, sleep problems themselves can sometimes be the reason you're waking up to urinate. A very common example is obstructive sleep apnea. Many people who have sleep apnea, or even undiagnosed sleep apnea, frequently wake up during the night and then end up going to the bathroom. So how can you tell if sleep apnea might be an issue? One sign is waking up in the morning feeling tired or not fully rested. If you share a bed with a partner, they might notice that you occasionally stop breathing during sleep, followed by a snorting or gasping sound before you start breathing normally again. That pattern can be a warning sign of obstructive sleep apnea. Another possible clue is having a larger neck circumference, which is sometimes associated with this condition. If you notice these symptoms and you're waking frequently during the night, it's important to discuss them with your primary care doctor. Before I finish, I want to share one final thought. If you are older or have mobility challenges, getting up at night to use the bathroom can carry an important risk, falling on the way there. This is something your doctors worry about as well. Fortunately, there are a few simple things you can do to make nighttime trips to the bathroom safer. First, consider installing motion sensor lights that automatically turn on when you walk toward the bathroom. That way, you don't have to search for a light switch or walk through the dark, which can help prevent tripping over something you might not see. Second, you may want to use a bedside urinal or a bedside commode. Having one close to your bed means you don't have to walk far in the middle of the night. Third, make sure the path between your bed and the bathroom, or bedside commode, is completely clear. Before going to bed each night, take a quick moment to check that nothing is blocking your way. Removing obstacles ahead of time can help prevent a dangerous fall later in the night. Alright, I hope you found this video helpful. Thank you so much for watching. And as always, remember to take good care of yourself, because you truly deserve it.